Hi everyone, this is Dr. Sunahita Agarwal from Arya Dental and Orthodontic Clinic, Lucknow. And today I am going to talk to you about something very new, very special, and that's going to benefit all of you. So, I have come across many patients in my day to day practice where we have seen adults, but we are going to talk about children. Okay, children we have seen they have snoring issues, they have airway problems, blocked nose, or they sleep with their mouth open. That's what the parents complain. So, for these patients, we used to usually prescribe some palatal expanders that used to have a key that used to be cemented in your child's mouth, and then you have to use a key to expand the palate. So, the basic logic इसके पीछे ये था कि if your palate is expanding, then your airways are widening up and the child is able to breathe more freely and better. So the snoring is reduced, or the competency of the airway is increased. So you get better results. But the problem was these palatal expanders were a cumbersome thing for the parent and the child also. These used to be bulky, they used to be cemented in the mouth. The patient could not eat properly, and going to school and all, it was a headache. And for the parent also, seeing their child like that, and also the parent had to turn a key each time. If every day you need to turn a key to expand the palate little by little so that you get the desired width. Now, what we have, there was a lacunae here because we are talking about aligners, we are talking about invisible braces where we are adding more comfort, more customization, less pain, better results, better accuracy. But this area was not touched upon. So, whatever expansion we had to do in kids as well as in adults, I was incorporating in the aligners. Each one of us do that. We expand the arches in the aligners itself, and we hope the palatal expansion also happens and the airway becomes better. But now the Invisalign has launched, is going to launch. It is already there. I mean, in other countries, but in India, we didn't have any access to that. They are going to launch the IPE, that is the Invisalign Palatal Expander. Now, this is a revolutionary device. It is very thin. It's also customized to the patient's palate. It goes and hooks onto the teeth. The patient can remove it by itself. There is no key, and the patient can remove the palatal expander by himself, and there is no key that is need to be turned. The patient can wear it, and then every day you can change it, because every palatal expander, suppose you're starting at 0, you're wearing one palatal expander, the next day when you wake up you go and wear another one. So the change between 0 and this expander would be 0.25 mm. 0.25 mm means it is like less than a half of an mm, or one fourth of an mm. So the pain thing is reduced, the comfort is increased, there is the bulkiness is not there. The patient can wear it and go to school, come back, eat with it, remove it and eat, whatever. That can be done. And the expansion happens very quickly. So we are expecting maximum of 10 mm expansion within a month, but I don't think all patients require that. Some require 3 mm, 4 mm, 5 mm. These expanded arches will also help. If you notice, sometimes what happens, mouth breather, how it occurs is when the patient is not able to breathe through the nose, then they start breathing through the mouth. Your tongue posture becomes low. Usually, our normal tongue posture should be against the palate. But what happens when the mouth is open, the tongue falls down. When tongue falls down, the forces that are there, that are balancing your cheek forces, that goes down. So your arches tend to collapse or contract. Now, when your arches tend to contract, what happens? Ek to you are having mouth breathing, you are having snoring, plus when your arches contract, the result in your front teeth is the front teeth go forward. So everything moves forward. And then you go for braces at 12 or 13 years of age, and then we say, yeah, we don't have space, so we need to extract. We need to do something. We have to extract teeth and then push back the. So this is a step that you can take In mixed dentition, matlab in kids that are 8 to 10 or 6 years also, till 12 years, so that you avoid extractions also, because when you're expanding the arches, then you're actually gaining space, and you're actually getting the teeth back. So when you are expanding the arches, you are gaining space. Your teeth will not fall forward, they will come in. You can get them in, and also you can avoid extractions at the later stage also. So this is one of the plus points of having a palatal expander early on during the mixed dentition. Matlab, not at 12 years, 13 years, though palatal expanders work at a later age, but they are best when they are done in mixed dentition, when you have a combination of permanent and deciduous both. That is called as mixed dentition. That is around 8 to 10 years. That is the best time to have an expander. So expander can help with the breathing, can help with the snoring, can help with the lack of space for the erupting teeth. Sometimes you see that there is no space for the teeth to erupt because all the space is gone somewhere. The arches have contracted, there's no space. So you can expand the arches, get the teeth out. So that can be a very good indication for palatal expanders. Now, these expanders are from Invisalign. You can use these expanders, and for doctors, I'm saying if they want to go for braces after this, they can go for braces, or they can go for Invisalign also after this. Invisalign first or Invisalign teen. That is your choice. But expansion mainly creates space. After that, you can align the teeth using braces or aligners. That's your choice. Now, when is it coming to India? It's going to be launched. The expected date is around the mid of July. They have some great offers for us. So if you feel that your child is facing some problem, breathing difficulty, sinusitis, or snoring problems, or mouth breathing problem, or you can see your child's front teeth coming little by little forward, this is the time to prevent that. This is the time where you can go for a consult, get a scan done, see whether the child requires an expander, and get the expander, and then avoid extractions at a later stage. So that is why I feel this is a very good innovation that is going to be launched, and we can help you out. If you feel that your child needs that, you can call on the given number, book your appointment, book your scan, and then we can show you. So that is it for today. I will see you with another video and something else for you to learn. Thank you.